morning, everybody. Thank you for being here today. Such a lovely day in South San Francisco, isn't it? I'm from South Florida. I'm used to 90, 95, all right? This is chilly weather, but I'm loving it. I'm loving it. It's great. I love being in it. All right, so for those that don't know, my name is Stuart Schlossman, and I too have multiple sclerosis, and it was a long time ago of how this began and what it's about and why I do what I do. And if you want to speak with me about it, we could talk about it after the program. So you're here at an MS Views and News program, and MS Views and News provides these educational programs right now in 22 states. We normally average about 67 people per program. So we're glad when we do have smaller venues because people do need to learn from everywhere around. We do provide programs in rural America as well as we just get into the big cities often. So our crowds can range anywhere from 8, which we recently had in Montgomery, and we've had as many as 285 in South Florida. So we are glad that you are here today. This is our very first program in this portion of California. So again, we are glad that you came. Next year we hope to do it again, but maybe next year we'll move it over to like San Jose or somewhere else, maybe to the Oakland side, all right? Maybe we'll do both, all right? Make it really worthwhile. Okay, and that's what we want to do for all of you because, again, we're just trying to provide something that you may not be getting at one of your local programs. We're not a pharmaceutical company, so we do get to provide different types of programs for you. Thank you. So, for today, I want to first thank Sanofi Genzyme because they gave us the dollars to do today's program. Without funding from the pharmaceutical industry, thank you. Thank you for clapping. I appreciate that. Can you get everybody else? Thank you very much. We want to thank Sanofi Genzyme for providing us with the grant to do today's program. And we also greatly want to thank Teva Neuroscience for giving us the sponsorship to video record today's program. Again, we cannot fund these programs without the pharmaceutical industry. So we're really glad that they, too, want to make sure that you are learning everything that you possibly can about multiple sclerosis. It's not just about their medication. They want you to understand and learn, and it's not just the patients that they want to learn. They know that the backbone to the patient is the caregiver. We know this as well, and we very much appreciate when caregivers attend our programs. Also, we want to thank the other pharmaceutical companies that were outside today that helped to sponsor today's program. And that was also, we had Accorda Therapeutics, we had Biogen, Genentech was supposed to be here. Unfortunately, the person didn't come today. But again, we want to thank everybody for supporting what we do and knowing again that you are being supported by them to be at our programs. Also, I have to thank all of you for coming, right? I heard that some came from 2+ hours away today, and I want to thank you for that, all right? And I heard that one of the speakers today came from 3+ hours away just because there was traffic. Imagine that in San Francisco. Now you laugh. Great. All right, so listen, I'm going to get started with the program soon. Brian Hutchinson is going to speak first. He's from Dignity Health. He's here to speak with you about movement and how movement will affect and benefit you all. And then we're going to have Zhang Mi. She's here to speak with you. By the way, first, Brian's going to speak, and then we're going to do Q&A. Okay, I asked that the support group leaders, if they wanted to speak for 90 seconds about that group, that they could come up here and speak with you for a whole 90 seconds. Marie, would you like to come up and say something?
I've never said anything in 90 seconds. My name is Marie Hansen, and I am the support leader for the core group, which is in South San Jose. We meet at the Santa Teresa Library on the 2nd and 4th Thursdays, and we meet at 11:30. So we meet in the daytime. We're one of the daytime groups that meet. And Brian's group meets in the Santa Clara office. And Bruce is here, and Bruce is one of the leaders of the Santa Clara group. So the two of us have a... Anyway. Bruce, take the thing. You get to announce yourself.
Okay, my name is Bruce Southwick, and I co-facilitator of the Santa Clara group meet that meets the 2nd and 4th Friday at 11. At the Silicon Valley MS office on Scott Boulevard. But there's more opportunities for people. There's a first Thursday of the month, there's a 6 p.m. at the MS office. There's a group that meets in Palo Alto at the neuroscience, Stanford Neuroscience Building on the second and fourth Monday night. And there's also other groups. For example, going on right now in Santa Clara, there's a MS lunch that happens the second Saturday of every month at the IHOP at Stevens Creek and Lawrence. We're very active. Each group is different, so try them all out, find out which one fits you need.
Thanks to both Bruce and Marie. All right, so without any further ado, Brian, would you like to come on up? Thank you. And everybody, thank you very much. No. You get 90 and then plus the other amount of minutes.
All right. Good morning, everyone. It's a pleasure to see everyone. What I'd like to do is give you a little bit of my background first before we get started. As Stuart said, I work for Dignity Health, but specifically I work for the MS Achievement Center. And the MS Achievement Center, I have a little bit at the end of the presentation if we have time to talk about it. But we do wellness programs for people with multiple sclerosis. I started my journey in working in MS in 1992. So I've been involved now for 25 years, almost to the day, actually. It was August 15th, 1992, that I started with an organization called the Jimmy Hugas Center. And some of you may know the Jimmy Hugas Center. It is now known as Can Do MS. I was involved with that organization back in 1992 and actually up until 2008. And actually was president and CEO of the organization for about 6 of those years. So I helped with that particular organization in organizing programs for people living with multiple sclerosis and their family members. I've been in Sacramento now for about 4 years, and we've been, the MS Achievement Center has been in operation for about 3.5. We operate a number of different programs, including day wellness programs and other educational programs. But my background is physical therapy. And I've been working in the area of exercise and physical therapy rehabilitation for MS, as I mentioned, for the past 25 years. So what I want to spend some time talking to you about today is maybe a little bit of a different slant on exercise and MS. Certainly, I want to cover some of the basics, but I want to hopefully delve a little bit deeper. You've heard probably presentations in the past on exercise in MS and why it's important and all of those kinds of things, and I agree with all of those things, and I'm going to talk about them. But hopefully I can provide you a little bit more information about what we know from the latest research as to the whys and the hows, and then provide some practical strategies that you can use when you're looking at either starting your exercise program or perhaps progressing to the next level of that exercise program. So hopefully you'll come away with a few pearls of wisdom that we can look at. But when we start these types of things, what we need to do is talk a little bit about where we were and where we are now. So historically, exercise, as many of you probably know and probably actually received some of that advice, was discouraged for people with MS. It was thought to be harmful in that when people had an increase in their body temperature, and you all know what happens when you have heat, when you have exercise and you increase your core body temperature, many of the same things can happen. But at that point in time, it was thought that that was problematic for the overall disease. It was making the disease progress or actually causing exacerbations. When in fact, now what we know are they are pseudo-exacerbations in that heat will increase the temperature of the body, produce symptoms, which typically are transient. So they go away after your body cools down. It doesn't mean that they're pleasant while they're going on, but they do go away. And it was felt that individuals with MS wouldn't benefit from exercise because it was going to be this losing battle and always causing more problems. So people were told to avoid exercise. We now know that exercise is very beneficial for people with MS, not just from the practical standpoint of how it can help with mobility and how it can help with endurance and flexibility and strength and all of those kinds of things, and we'll talk about that. But we can manage some of those aspects of body temperature. We have cooling products. We have other things that we can do. We also have ways in which we can exercise via interval training. So we can find those areas that those sweet spots, if you will, in our exercise program that hopefully will allow us to continue and progress with that exercise program without having those symptoms. And with careful programming of exercise, you can gain many of the same benefits of exercise that everyone else can. And there's data and very good research to back that. The seminal study looking at exercise and multiple sclerosis was done at the University of Utah, and it was published actually back in 1996. And what they found in this very nicely controlled study of a 15-week aerobic exercise training was that there was improvements in areas of aerobic capacity, improvements in strength, as well as some of the physiologic measures like body composition, blood lipid levels, and then all of these other areas of things like depression that were measured and quality of life measures. So this is kind of old news, if you will, in terms of what we know about exercise, but it was really the first study that looked at that. If you look at the top here, you see that there's a couple of other studies that are listed. The one on the top was interesting because it was done in 1988, and it was actually done through the Jimmy Huga Center. And what they found in that particular study was that people didn't get worse with MS when they exercised. Okay, that's not really groundbreaking, but at the time it really was, because it was still that thought back in 1988 that if you exercised, you were going to make your MS worse. Okay, so that was an important first step, just like we do with all of our studies. It's a very stepwise fashion in how we need to find this information and then be able to move on to the next thing. So that was really the precursor to the 1996 study, and now things have really grown in terms of the amount of research that we have in the area of exercise and multiple sclerosis. So physical activity and rehabilitation. This is more for level setting, so we're all talking about the same thing. And I'm not saying it's right or it's wrong, but when I describe rehabilitation, I don't necessarily use that synonymously with exercise. Exercise is a part of physical rehabilitation, but in many cases, in a good rehabilitation program, it's very problem-focused. It's usually short-term, so to help you walk better, to help you be able to do something from a functional standpoint better, and you'll get X number of visits and you'll get X number of weeks to be able to measure that particular progress. Exercise or physical activity is something that is incorporated in an ongoing basis. And what we're looking at is potentially improving some of those functional areas. However, the goal typically of our physical activity programs are to improve overall health and fitness. We may see that side benefit of improving overall function, because if one of the problems with your fatigue, for example, is the fact that you are deconditioned, if you get into an activity program and improve your conditioning, that's going to improve your fatigue. If you have problems with functional mobility, if it's walking or transferring or whatever it happens to be, and that's secondary to decreased strength, secondary to deconditioning, improving strength will help those areas, okay? So that's what we're looking at, excuse me, in terms of physical activity and its intervention for people with MS. So I will use, in many cases, physical activity and exercise synonymously, but I like to look at it from a physical activity standpoint, because back in the old days, what we looked at were exercise being a very structured process, and we didn't count a lot of the things that we probably should have counted that probably fall under the realm of physical activity. gardening, things that you're doing where you're moving and doing it in a more continuous basis. We didn't count those things back in the day. When I was going through school for exercise physiology, that wasn't considered exercise. But now we give everyone credit for that, and we should, because it's an important part. And now it's being very well recognized by the American College of Sports Medicine and the CDC also. And that brings up this concept of exercise as medicine. And this is not specific to MS, but it is something that we look at and is being much more recognized in the exercise circles as a very important component. And this is one of the big areas that we look at when we talk about how we can utilize exercise for people with MS. Not only to improve functional capacity, like I was just talking about. If you improve strength, sometimes that may improve your ability to do functional mobility activities, but definitely to decrease health risks. Very, very strong evidence about exercise and the benefits in the area of cardiovascular disease. The fact that it decreases cardiovascular disease will improve blood lipid levels. In addition, there's very good information about cancer and how we can look at decreasing some of the effects of certain types of cancer with physical activity levels. Type 2 diabetes, very strong evidence about that area in which we can help control blood sugars through physical activity. Obviously, diet is an important part of that also. And obesity is now recognized as a cardiovascular risk factor, and we want to look at ways in which we can incorporate physical activity in order to decrease that risk factor, maintain optimal weight, and be able to eliminate, if you will, that particular risk factor that goes with cardiovascular disease. So this idea, or this concept of exercise as medicine, has been well borne out in a lot of research. These particular studies that you're looking at here are studies that are evaluating older adults, and I don't recall exactly how they defined that, but my guess is if it's like most studies, it's probably 55 and older. So they were looking at individuals and their levels of physical activity, and then they followed them over a long term and determined whether or not they had increased risk of cardiovascular disease. So you can see it was a relatively large study, 1,500 older adults, it says 65, sorry, 65 and plus, engaged in light intensity physical activity. The way that light intensity physical activity is typically defined is you can carry on the conversation, you're able to participate in an activity but not have to take extra breaths while you're doing that activity, okay? So that's considered light activity. Think of about typically a very almost social type of activity that you're doing as part of your exercise program. Those who engaged in greater than or equal to 300 minutes per week had all of these different benefits: lower cholesterol, lower body mass index, decreased waist circumference, as well as some blood levels that were decreased, okay? So the point to that is it doesn't have to be no pain, no gain. It can be light physical activity and you can gain the benefits. Now they've laid out some very specific guidelines that greater than 300 minutes of light physical activity, and remember, you're taking into consideration a lot of different things. It's not just your structured exercise program. But they've also kind of put that out into other areas. So if you do moderate intensity physical activity, 150 minutes per week is what is recommended. If it's high intensity physical activity, then it would be 75 minutes per week. Okay, so those are defined differently and are usually based on heart rates and VO2 maxes and things like that. But the point is, mixing and matching those things is perfectly appropriate. And an old study looking at individuals, large groups of individuals, demonstrated that individuals who are doing nothing and start to do something have the greatest benefit than those who are at the higher levels and go to even higher levels. So the take-home message is, if you're not doing something, do something, okay? If you're doing something, do a little bit more and try to add on that way. And as you can see on the bottom, if they did less than 300 minutes, they had a greater risk for chronic disease compared to those who did 300 minutes. All right, so when we talk more specific to MS, we look at some of these different areas, and this is what I want to spend a little bit of time on. Exercise benefits for areas of fatigue, self-efficacy, depression, stress, anxiety, bone mineral density, cognition, and then we're going to talk a little bit about some of the research in the area of the immune system. Okay. So, bone mineral density, we know, can be problematic for people with MS. It might be part of the vitamin D story, and all of you have heard a lot about vitamin D, and certainly I'm not the expert on vitamin D, and when Zhongmi comes up, perhaps we can talk a little bit more about that. But that's certainly something that could contribute. Steroids is another part of that story. Steroids are used, and probably not as frequently now, but certainly in the past were used very frequently, and that may contribute to challenges or decreases in bone mineral density. The fact that this is a condition that primarily affects females is certainly another component that we need to consider in terms of bone mineral density. So one of the interventions is physical activity, movement, weight bearing. All of those kinds of things help with bone mineral density. So we want to look at ways in which we can intervene. That doesn't mean you don't listen to your physician about vitamin D supplements or calcium supplements or any kind of other medications. But this kind of physical activity may be helpful from a preventative standpoint in delaying some of that decreases in bone mineral density. There have been some studies looking at MS, and most of them have been looking at it from the standpoint of there does seem to be an increase or a decrease in bone mineral density for people with MS. Not a lot of interventional types of studies yet. So this is the interesting area, I think, that is now burgeoning, and this is where I want to spend a little bit more time. We can, again, certainly get into some of the other areas about fatigue and depression, but I didn't structure this particular presentation that way because I wanted to give you a little bit more idea of where we are right now. So there is evidence that increases in physical activity also improve nerve growth factors. And specifically, what's been looked at in animal models is brain-derived neurotrophic factor, which is a nerve growth factor, as well as insulin-like growth factor. There are some others, more from an inflammatory standpoint or anti-inflammatory standpoint that we'll talk more about. But some of the nerve growth factors that we see can be helpful can be improved with increases in exercise. So what does it all mean? It means that perhaps this could be a part of the puzzle related to nerve protection. It may have part of the puzzle for how the plasticity of the nervous system can make changes to improve overall function. It may have some benefit in potential regeneration. Okay, these are all very hypothetical types of things, but that could be where we're heading with some of these types of interventions. We just don't know a lot of the specifics about what the dose needs to be in terms of the amount of time or the intensity in terms of how these things might come together. So, this isn't an immune system talk, but I wanted to put this slide up here, and this might be something that a number of you have seen before, just to make a couple of points. What we know about the immune system is that there's dysregulation within the people who living with MS. There tends to be an increase in these pro-inflammatory cells depending upon what they're exposed to, and you can see all those things on the left-hand side of the screen. So the Th1 cells, the Th17, the IL-17, all of these things are considered pro-inflammatory. And then the regulatory cells are the ones that it tends to be out of whack a little bit. And those are the things like IL-10, et cetera. So if we break that down, what we look at in terms of exercise is, with exercise, what we do tend to see is, with these pro-inflammatory cytokines and cells, is we see a decrease in the expression of those particular cytokines, as well as that kind of cell. And we see an increase in the anti-inflammatory side of things. So we start to bring back a little bit of that balance, perhaps. Again, we don't know exactly what we need to do in terms of making this as part of an overall interventional strategy, or whether or not this can be additive to your existing immunomodulatory therapies. That hasn't been looked at. There's certainly some theories out there that may be the case, but we do know that this does occur. We see improvements in those, a decrease in those pro-inflammatory cytokines and an increase in the anti-inflammatory. So this is kind of summarizing that, in that the Th1 cells produce large quantities of these pro-inflammatory cells or cytokines. Interferon gamma is one of those, and it is seen in large quantities with the Th1 cells. In addition, we see an increase in the Th1 cytokines during an MS relapse. Th2 cytokines, those anti-inflammatory or regulatory ones, are seen more during remission. Th17 cells are correlated with MS lesions. So you can see the picture here is these pro-inflammatory cytokines have a very strong relationship to MS and lesions and exacerbations, etc. And the regulatory cells, when we can get those in greater quantities, tend to have a relationship to the relapse side of things. So here's some of the studies that have been looking at animal models and exercise. I always loved forced exercise. I love that phrase. But forced exercise in the animal model, so these are mice that are being looked at doing particular types of exercise. So essentially what happens in the case of the first study is they're put on a treadmill. Okay? They're put on a little mini treadmill, a little mouse treadmill, so picture that, and they're forced to walk. Okay, and they're forced to walk for a certain period of time, and then they are measured in these particular cytokines in these different cells. In the voluntary exercise, they have a wheel, so they have the choice of doing that exercise as opposed to being forced. So the forced exercise and the exercise in general showed improvements in areas of acute and chronic stages of EAE, okay, the mouse model of multiple sclerosis. In addition, they looked at swimming and found improvements in areas of BDNF, that brain-derived neurotrophic factor, but they didn't see some changes in some of these other areas that we might expect to see. Okay, so the data that we have is not overwhelming, but there are trends that we're seeing with a lot of this information related to exercise and some of these nerve growth factors. So how does it all translate? How do we get it to translate into what it is that we want to know from the animal models to looking at it from the standpoint of humans? Okay, I realize this is a very small slide, but what this is these are the human studies that have been done thus far. I believe I have a summary slide, but I had to change everything, so it could be possible that one got missed. But anyway, these are the human studies that were done, and they've been done from 2006 forward, and they're showing some very similar results. Let me see if I got that slide. Nope. So if we go and look at some of these typical slides, most of these are 30 minutes of aerobic exercise. Some of them are combined exercise, looking at exercise that is aerobic in nature as well as strength. So there's a combination of the two activities, and they measure different things. It's hard to see up here, I realize, but they're measuring some of those nerve growth factors, tumor necrosis factor, BDNF that I mentioned earlier, interferon gamma, and so on. So they're looking at these pro-inflammatory and anti-inflammatory cytokines and the relationship between those and the exercise. They're looking at them pre and post, and often they're looking at it in groups that aren't doing any kind of exercise or are in some sort of wait list or voluntary exercise program. So what they have found traditionally is that the interferon gamma, which is that pro-inflammatory, has been decreased with exercise. The Th17, which is also a pro-inflammatory, has been decreased with exercise. And we're seeing improvements in areas of BDNF as well as tumor necrosis factor. They also have, and those are nerve growth factors. In addition, they've looked at some clinical measures, and they've been able to measure looking at people pre and post their exercise program, and some of the clinical disability measures, EDSS is something that you're probably familiar with, has been decreased in a couple of these also, because people have improved their overall function and they've decreased their EDSS level. Okay, so all of that is to say that there's good evidence moving forward from the standpoint of a baseline that we can start to build upon to look more at exercise and its effect on the immune system. I'm not suggesting that this is something that you do in lieu of your immune modulating medications. We don't have that data yet, but we do know that it is something that can be helpful in terms of that regulation of the immune system. So that's kind of the take-home message for where we are with MS and the research in the immune system. Another really interesting area that they're looking at is cognition and the effects of physical activity on cognition. And there have been quite a few studies that have looked at exercise and physical activity and the benefit for people with MS on areas of cognitive function. Some of those have been looking at MRI images and the effects of MRI, or the effects of exercise on MRI parameters. And what you'll see is that the aerobic fitness program improved or was associated with cognitive performance, brain activation on fMRI, which is a functional MRI, in which you are doing some sort of activity or being asked to do some sort of activity and certain parts of your brain light up. So we can identify whether or not you're getting good activation with that activity. In MS, what we see is often greater areas light up because of that ability to, or that plasticity. In addition, they've shown improvements in white and gray matter volume. Okay, so these are areas that are associated with cognitive performance or cognitive function, and exercise training improves those particular areas. In addition, in some of the other smaller studies, there's been an inverse correlation for individuals, and you may experience this also, with physical activity and their perceived cognitive deficits, what they feel their thinking skills have been like. So that's a patient-reported outcome that they feel that their cognitive function isn't or is better or isn't as bad with their physical activity program. To balance that out, there have been other studies that have looked at yoga and aerobic exercise that didn't show any changes in cognitive function. So this gets back to that aspect of we don't know exactly, and it probably is very individual, we don't know exactly what that particular dose is for everyone. What's the intensity at which you need to do the exercises, and what is the length of time or the frequency or whatever it happens to be. But there is definitely there are definitely effects in the MS population, and beyond, there's a lot more data looking at the older adult population and even into Alzheimer's. There's some data looking at cognitive function and exercise and showing improvements. All right. So now we're going to move on to some aspects that are, I hope, a little bit more practical for you around tips for successful exercise. All right. So how many of you do some sort of exercise? Excellent. Preaching to the choir. I like that. How many of you do some sort of group exercise? Okay. How many do the individual type of exercise? Okay, good. So there's no right or wrong. There has been some evidence, not specific to MS, that there tends to be a greater level of adherence with your exercise program in a group format because there's an accountability, there is the social aspect that goes with that. But that's not true for everyone. Some people like to exercise on their own, and that's perfectly fine and are self-motivated to do so. Some people need that group aspect. So it's important to look at what works for you in order to be able to identify how you're going to be successful. Goal setting is a big component. You want to be able to make sure that you have specific goals around your exercise program. Otherwise, you're going to be in that dilemma of the old New Year's resolution. I'm going to start exercising this year. Okay, so when? What are you going to do? How much? So on and so forth. But it needs to be something that you can check in on and measure. Otherwise, it's going to be much more difficult to sustain and continue with your exercise program. And then looking at activities that may work for you. And I'm going to talk about some potential alternative types of exercises. Again, some of them you may be doing and you can comment on when it's all said and done. But it's not the traditional type of walking on a treadmill, swimming, those kinds of things. So adapting activities is an important component. These are some pictures from our Achievement Center. The upper left is individuals playing volleyball with a balloon. So they're practicing a little bit with their balance and a little bit of their core strength, hand-eye coordination, those kinds of things are things that we do as part of our group activities. The one on the upper right is what is known as a dual cable. You've probably seen it at many of your gyms, but it's very adaptable in terms of being able to move the arms of the machine, which is right here, up and down to do many different types of exercises. Our particular machine has a relatively low level of weight, so you can do some strengthening exercises without having to go to a traditional gym where maybe the first weight is 5 pounds or 10 pounds in many cases. Ours starts with 3, so that's helpful. The lower level one is someone bowling and having a little bit of assistance, standby assist, but using one of the ramps to be able to bowl. This particular individual primarily is in a wheelchair, but is able to stand and participate in the activity. And then the right lower one is what is known as the MotoMed. So this is an individual who is non-ambulatory, doesn't have much movement in lower extremities, but we can at least get some range of motion and some activities, as well as some active assistive movement using that particular machine. So finding what works and adapting your activity levels is an important thing to do. Pole walking. How many of you use some sort of poles to walk? How many have heard of this? Okay. All right. So the poles, it's a little bit dark, but the poles are right here. Usually they're bilateral, and they're kind of like hiking poles. Some people use ski poles, that kind of thing. They tend not to be quite as sturdy. They make poles specifically for walking and can be sized appropriately. So this is something that can be helpful from a balance perspective for people. I would highly suggest, if this is something you want to look at, that you see a physical therapist and get some training in that particular area. But they can be very helpful. In addition, what people tell us is that they get a full body workout because they're using those upper extremities very briskly as part of their walking process also once they get used to it. So it can be a very good workout, and it has that extra layer of stability and safety for many people. This is some adaptive equipment that we've introduced to our membership. The one up on the left is a three-wheeled tricycle that is recumbent. So for those who may have balance problems or difficulty getting on a bike, this one is a recumbent bicycle that you can pedal and steer with your hands. So as long as you've got good trunk control and you can use your lower extremities, that can be a good option. This one also comes with an assistive motor, so that's getting a little way from exercise, but sometimes people fatigue and they kick in that motor for a hill so they can go places and still have the ability to cycle and get up that hill when they can kick in a little bit of a motor. So there's different options that can be incorporated. We've certainly offered up some ideas for the company that produces this, and I think there's some prototypes out there looking at like a swivel seat that might allow people to access it a little bit better. Down below is a recumbent elliptical, and there's a number of different brands on the market. But what we like about these types of machines are that it spreads out the workload. You have the ability to use your upper bodies and your lower body in order to participate in the exercise program. Therefore, if you have fatigue in your legs, you can use your arms a little bit more to continue with the exercise and vice versa. Adaptive skiing. We're not too far from Tahoe, so we have some folks that go up there and participate in adaptive ski programs. So this is a way in which you can stay involved in perhaps something that you've done in the past. I will tell you that Can Do MS, which is an organization formerly known as the Hugo Center, does an adaptive ski program up at Tahoe. The past 2 years anyway, I suspect they'll continue. So that would be an opportunity if you've gotten away from skiing and it's something you enjoy doing, perhaps you could get back into it. So you could visit their website and get some more information on that. But sit skiing with tethers is one way to do that. This is a sit skiing with the instructor actually holding on to the bucket so that they have a little bit more control. If you tether that person, they have to be able to use their trunk and be able to turn a little bit more, but you're still safe. But that's kind of an advancement in the sit skiing, is going to the tethers. This is known as a CADS system, constant articulated dynamic struts. This is a development by an inventor who developed it specifically for people who had ACL surgery. And what it does is it provides a bit of an upward force. So this attaches to the pants and then attaches to the ski. So it provides a bit of an upward force and then a downward force. The downward force helps with edging for the skiing, and the upward force takes a bit of stress off the knee. So that's why it was developed. But what we find with our population is that people fatigue quickly. And they fatigue in their quads. And this particular device often will help them maintain upright skiing for a little bit longer period of time. So it's something to look into if you've given up skiing and that's the reason, that you can perhaps continue with that. Aquatic exercise. I said I would not necessarily talk a lot about the traditional types of exercise, but I think aquatics is very important to mention. There have been more studies probably looking at aquatic exercise than some of the other things that I'll talk about. And they do show improvements in areas of balance, strength, fatigue, quality of life. A lot of people like it because of the coolness of the water. Some like the buoyancy. All of those things can be really helpful. The challenges sometimes are finding access to a pool that is A, the appropriate temperature, and B, that you can get in and out of without having to without having to make significant adaptations or have a lot of physical assistance, has a lift or whatever. But there are a lot of things that people do in the water that they can't do on dry land, and they express that, and that can be really helpful as part of their exercise program. So when we talk about recommendations or prescription of exercise, what we look at is the mode, the type of exercise, the frequency, intensity, and time. So the frequency of an exercise really just depends upon your particular place. What I'm going to tell you is I'd like to see you do it almost every day. And plan not to miss more than 2 days consecutively. All right? What you're doing with that is you're making a habit. You're incorporating a habit, and that's what we're looking for as part of starting an exercise program. The intensity, what we like to use is the rate of perceived exertion scale, and I'll show you that here momentarily. We also like the 2-hour rule and the 10-minute rule. Now, the 2-hour rule is if 2 hours after you exercise, you don't feel as good or better than you did when you started, you did too much. Okay? That's pretty simple. The 10-minute rule can be adapted. It could be the 5-minute rule. It could be the 2-minute rule. But what it is it's going through that process, going through that therapeutic ritual to start your exercise program. So put your shoes on, get your swimsuit on, do whatever it is that you're going to do. We all have those days where we don't want to exercise, okay? And so you go through the process and you start with the activity, and you start with your swimming, or you start with your bicycling, or whatever it happens to be. And if it 2 minutes, 5 minutes, 10 minutes, or whatever it happens to be, whatever your preset time is, you don't feel any better, it's time to stop. Okay? That's an MS day that's probably not going to go away. You need to give it enough time. But a lot of times it's that mental fatigue, getting past that. If you came home from a day and you sat down on the couch and you haven't done your exercise, hardest thing to do is get off the couch, okay, and overcome that piece of it. So go through the ritual, start the activity. If it's not your day, it's not your day, but you've given it a shot, and a lot of times the fog will clear and you'll feel better once you took the dog for a walk or did whatever. And then the time duration really depends upon where you are in starting the program. Most of the journals will tell you need to do 20 to 40 minutes of aerobic exercise to gain the benefits. I'm going to tell you if you do 10 and break that up twice, it's the same thing. So look at ways in which you can do that. This is that rate of perceived exertion scale. The goal is not to get to 10. The goal is to find an appropriate level of that being able to breathe and participate in your exercise. 2 to 4 is usually what we look at, okay? So group versus individual exercise, goal setting, finding activities in which people can participate. It's important to look at how you can educate on strategies and ways to monitor your progress. So the practical rules are the 2-hour rule. If you don't feel as good 2 hours after you started, or at least as good, you did too much. Okay, start low, go slow. There's a number of different ways in which you can look at incorporating your exercise well-rounded program. If you need help, seek assistance. That's important. Okay, I'm just going to run through these very quickly. Yoga is one of these areas that has been studied and can be beneficial from a flexibility standpoint, strength, quality of life, etc. Pilates, this is something that we employ at our center. There's not a lot of research out there, but what is out there has shown that there is some benefit. The relatively small studies, we need more information. But if you like it and it's going to get you active, I think that's good. Tai Chi and Qigong are other areas that are being looked at, and improvements in walking speed and muscle stiffness have been reported in certain studies. Horseback riding. This is another area, therapeutic horseback riding. Hippotherapy tends to be a little bit more specific, but there are reports of improvements with those particular activities also. And then dancing. There's been some recent research out of Marquette University that has looked at dancing, and specifically it's looked at 4 different types of dancing: push-pull, waltz, foxtrot, and the rumba. and they found this to be a very beneficial way of increasing your heart rate. And obviously, it's fun. So this is something that you can do. There are programs out there that can adapt. I heard about a program back east that does some pool dancing. So obviously, you've eliminated that component of the weight-bearing piece, and people can be a little bit more active in the water. So when you get down to thinking about different areas and decisions that you make, exercise is one of those lifestyle things that you often have to make a decision about. And all of these decisions kind of fit within one of these boxes. Low risk, high reward. Low risk, low reward. High risk, high reward. And high risk, low reward. Okay? Typically, we want to stay away from this box, although there certainly are times when it's appropriate to look at a high risk if you're going to get a high reward. I'm sorry, this box. High risk, low reward. You don't want to take on a lot of risk for very little reward. You may be willing to take that on for a high reward. Exercise tends to kind of fall, oops, wrong button, in the top. Okay? Typically a very low risk, might have some high rewards. We talked about some of those benefits. It may not have as much reward as we think in the area of immune regulation, etc. But it's really a low-risk intervention, something that everyone can find something to do. And I think if you need the help doing that, you need to seek out your assistance from your healthcare professionals and continue to come to educational events like these. Thank you.
Thank you. Thank you, thank you.
So I think this is Q&A time.
This is going to be Q&A time, and I'm going to go around the room. First off, another big round of applause. That was a nice conversation. Thank you.
You're welcome.
So I'm going to go around the room. Does anybody have any questions? Anything about exercise, food, or anything else that he spoke about? Even if he didn't speak about it, if you have a question that's similar, please ask.
Well, I guess that my question would be is with the low risk, high reward part, how do you factor that in to fight inflammation for exercise, right? Because I think you've kind of basically said those things, but what really works for inflammation part?
Well,
with exercise.
Yeah. So what I will just harken back to what we have in terms of the information regarding some of those anti-inflammatory cytokines and those pro-inflammatory cytokines being decreased. All of the studies have looked at in the neighborhood of 20 to 30 minutes of exercise. Some of them have looked at lower intensity, which is about 60%. And some have looked at maximum heart rate. And then some of them have looked at more moderate intensity, which in a lab is going to be right around 75%. Both have shown benefits. There does seem to be a slightly improved benefit with the increased intensity. However, those studies also looked at combined exercise training. So they looked at strengthening as well as aerobic exercise. So there's just too many variables now to say exactly what we know about that and what we can say with certainty. What we can say is that if you're not doing something right now, that looking at incorporating some exercise may have those benefits. And we need more numbers, because the other thing that I didn't mention about those studies is they're relatively small, usually 10 per group. So the maximum, I think, was 30 people in some of those studies. So we need a lot more information. But I think the trend that we're seeing is from both the animal models as well as the human studies, is that we're going to need to look at how we incorporate intensity in order to have some of those effects.
Next question.
Hi, Brian.
Hi.
I actually have a question about the MS Achievement Center.
Okay.
I know it's in Sacramento,
Uh-huh.
and I was just wondering, so do you have to do an application to become part of it? Or I live in Vallejo, and I'm just hearing about it, and I really am interested.
Okay.
So just want to know more about it.
We have a number of different programs. The main programs that we offer are day day wellness programs. One is a 5-hour program from 10 in the morning until 3 in the afternoon, which we incorporate physical activity, cognitive stimulation, education, and then socialization, I guess is the best way to put it. So each person has an individualized exercise program. We have a group exercise program, which is either yoga or Pilates. We kind of rotate those two in and out. The cognitive stimulation program is using iPads. We incorporate Lumosity as part of one of the offerings, but we also do some other apps that are available. So the cognitive stimulation program is really just to get people thinking and exercising that area. We don't have a lot of good data, but again, it's low risk. So it's something that people enjoy. It's something that they can incorporate at home. And then the education piece usually is a group discussion around various aspects of MS, et cetera. And then the socialization, which is probably one of the biggest benefits that we hear, is that you're with 23 other people who are dealing with very similar concerns and questions, and they can be a great resource to answer those questions. The other program that we offers very similar components, but it's 2.5 hours. It runs from 11 till 1:30, and that takes place on Fridays. But we do either group or individualized exercise and cognitive stimulation and education. To answer your question specifically, there is an application process. I can talk to you afterwards. I've got some brochures with our website and such. Okay?
I have a question. When I going to exercise, any exercise, after 10 minutes, my whole body going to fatigue. And I don't know which exercise is good for me, or should I do any exercise or not?
Okay. I missed what your whole body does. It goes...
Going to numb.
Goes numb. Okay.
Yes.
Okay. Typically, and again, not knowing you specifically, but typically what that often means is that core body temperature is heating up a little bit, and we need to figure out ways in which we can decrease that. So a couple of things that you could look at and try is interval training, number one. So instead of doing 10 minutes of exercise, and if it hits every time at 10 minutes, stop at 8, do some stretching, and then go back and do another 5 or whatever it happens to be. So interval training often can break up that process, and the data from a cardiovascular standpoint demonstrates that what we know is it's the totality of the exercise that's the most benefit. So in general, 2 10-minute sessions of exercise is equal to 20 minutes of continuous exercise. Now, there may be some other neuromuscular changes that are beneficial on that other side. But from a cardiovascular standpoint, that's what I would look at, and that's how I would start to try to build that. The other thing is, if you have a cool environment in which you could exercise, maybe that's already occurring, so you can check that one off. Looking at a pool, that's a cooler environment. But you may need to play with that intensity a little bit too, and reframe what your intensity of your exercise is. So you can do that through some types of exercise testing. It may be something that you can consult with a physical therapist or your physician or healthcare provider. But I would try that interval first. The question was, are we the MS Achievement Center only in the Sacramento area? The answer is yes. We do some outreach education programs. We were down in Monterey a couple weeks ago. But as far as those programs that I just described, yes.
Hi, so I'm being evaluated for a weighted vest at St. Mary's coming up soon, and so what should I expect, like, as far as the evaluation?
I've not seen an evaluation take place for the balance-based torso weighting, so I don't know exactly how that all works, but I know of them. So essentially, I think what you can expect is, if you've been to a physical therapist before, so you can expect kind of a physical therapy evaluation to start identifying where your balance problems exist. And then it's my understanding once they get the vest on you, it's a bit of trying weights in different areas based on their physical or their clinical exam, and then fine-tuning where they place those weights based on the response that you have with other kinds of activities. So if they have you stand, for example, with your eyes closed and see what your balance does in that particular situation, once they get the weights on, they're going to have you do the same thing. And so they're going to look at it in different ways and different components. If they're going to evaluate you a little bit more from your walking standpoint and how your balance is with that, they're going to redo that once they have the weight, the weights on. Has anyone here gone through the process? Am I close? Okay. Okay.
Okay, are there any other questions for Brian? Anybody have a question? Bruce, did you have a question? No? Okay, sorry. All right, so, wait, seem to have a question here.
All right.
I guess this would be for like Bay Area. If we should have something like this in the Bay Area.
What's that?
Like everything he just said. These programs, cognitive.
I'm happy to talk to anyone about that. We were very lucky and blessed to have a grant from the Conrad and Hilton Foundation, who operates a very similar achievement center in Southern California at UCLA. And they provided some base funding, and I was not involved in the process prior to that. I was then brought out after that. But yeah, I think it's a nice program, and I was recently at the Consortium of Multiple Sclerosis Centers meeting, and gave a presentation on these types of programs. And there's a lot of cool programs across the country that pull components. So there are ways to kind of build something with maybe not the amount of cost, but it does require some money and some commitment from the healthcare team in order to make sure that it works. Perhaps.
Okay, thank you. Thank you, Brian.
Yes.
Shake hands. Thank you very much.